These are questions that are curious to be answered by those who want to have a dental bridge. It is a form of treatment based on obtaining support from neighboring teeth to fill the gaps that occur in case of loss of one or more teeth. When one or more teeth are missing, the process of replacing the missing tooth with a body and covering and supporting the front and back teeth is called a bridge. Support teeth are reduced and covered, and the missing teeth are completed with the body. That is, the part called pontic. Sometimes you may also hear the phrase making a crown instead of a dental veneer. A dental bridge consists of dental crowns connecting both sides of the bridge and the false tooth or teeth in the middle. Generally, there are 4 types of dental bridges: traditional dental bridge, winged bridge, Maryland bridge, and implant-supported bridge. These bridges can be applied to replace the missing tooth, depending on your mouth structure, age, and choice. Traditional dental bridge is the use of healthy teeth to the right and left of the missing teeth as bridge pillars to be filed and reduced and fixed to the bridge. Then, the prepared bridge dental prosthesis is placed on these fixed teeth. Winged dental bridge is a treatment method used when there are natural teeth on one side of the gaps created by missing teeth. In this treatment method, one side of the winged dental bridge is attached to the natural tooth. Winged dental bridges are also called suspension or balcony bridges. It is a method generally used to save patients from removable dentures. Maryland dental bridge is a treatment method applied to the gap created by a single tooth by making use of the teeth adjacent to this gap. The aim of this method, which is very successful in terms of aesthetics, is to fill the gap created by the missing tooth. It is applied by taking support from the back surface of the neighboring teeth in the front and the chewing side of the teeth in the back. It is generally produced from metal-based porcelain. It is mostly used in cases of loss of front incisor teeth. Implant-supported bridge prosthesis applications are a method in which a 3 or 4 member fixed prosthesis is placed on 2 implants, which is performed in cases of multiple tooth loss. Thanks to implants, there is no need to cut adjacent teeth, thus preserving healthy teeth. In addition, the jawbone in the place of the extracted tooth is preserved. In implant applications, metal screws placed in the jawbone by a maxillofacial surgeon act as the root of the tooth. Afterwards, porcelain teeth that look like teeth are inserted. This method can be applied to single tooth losses as well as to multiple tooth losses. A dental bridge is a restorative dental treatment solution designed to close the gap left by a missing tooth. The bridge holds prosthetic teeth in place by anchoring them to adjacent teeth. Dental bridges can be made from different materials, such as gold, metal, ceramic, porcelain, zirconium. Dental bridges, which usually last 10 to 15 years, can also last 5 years. This completely depends on your oral hygiene and your body structure. Bridge treatment is a multi-step process that requires multiple visits to the dentist. First, the dentist applies local anesthesia to the gum tissue surrounding the tooth next to the bridge. He then reshapes the teeth to accommodate the crowns. The crowns need to fit securely to hold the bridge in place. When teeth are reshaped, an impression is made of the missing tooth and surrounding teeth. This impression is sent to the laboratory that will custom make the bridge. A temporary bridge is used to fill the gap until the permanent bridge is ready. The most important advantage of a dental bridge is that it ensures oral integrity and comfortable eating. Thanks to the dental bridge, you can eat whatever you want and bite hard fruits such as apples and quinces with ease. The bridge contributes to your smile and making your teeth look more beautiful. Disproportionate mouth closure caused by missing teeth is eliminated. Speech difficulties experienced as a result of tooth loss also disappear. It eliminates the risk of tooth slippage that may occur due to missing tooth or teeth. After treatment with a dental bridge, the position of other teeth is also preserved. Bridge teeth are one of the ideal methods to get aesthetic and healthy teeth in case of tooth loss. This video is for informational purposes only. We would like to emphasize the importance of consulting with your dentist to determine which treatment is most suitable for you. If you find our videos informative, please do not forget to like and subscribe. Wishing you healthy days.